start. So looking at, we've got approximately 10 minutes per company, supplier, innovator. So the first one on the list is Theo.
Theo, yes, thanks, Helen.
Theo, apologies, sorry.
No worries.
Over to you. Welcome.
Thank you very much. Let me just share my screen, guys. Let's see if anyone else can have a technical issue. How's that? Can we see? I can't see or hear anyone, but if you can, someone give me a nod that you can see my screen, that would be helpful.
Yeah, it's working.
Yeah.
Yes, I can see the screen. Yes.
Perfect. Thank you very much. Yeah, so thanks, Helen, Joe, for giving us the opportunity into the AHSM. My name is Pete Grimbergs. I'm the Chief Medical Officer at Equal. I'm a physio by background, and I guess the drive behind Equal and the sort of mission we're on is really we're looking to try and solve patient pain points by providing, whilst also providing safe, reliable clinical systems. And that's sort of the ethos and mentality where some of the vision for some of the products that we've developed has come from. So the primary product that we have in operation at the moment is a system called Theo, which is effectively an end-to-end MSK system looking to augment the MSK pathway with two propositions. One's called Theo Access, which you can see on the left, which is a digital triaging system. The other one is called Theo Engage, which you can see on the right, which is a standalone supported self-management system for patients with MSK issues. I'm not going to go into all the features of these platforms, but I want to give you a sense as to exactly what they're doing and the success that we've had through them to date. Theo Access, as I say, is our triaging system. This is currently available to just over 12 million people in the UK, in operation in over 26 different CCGs. It's effectively a self-driven triaging system that's available 24/7. It's available in multiple languages, and it can be accessed via any web-enabled device. So you're seeing an example here of someone using it on a smartphone, but actually anyone with internet access can get access to this via a URL that can either be they can be directed to in terms of in a self-referral journey potentially, or they can even be directed into via an SMS invitation for people that may be sitting on a waiting list, awaiting treatment or requiring additional triaging services. How it works is patient driven. It's very interactive. It uses this chatbot feature to effectively understand patient symptoms, get an understanding as to the types of issues they're having, and also collect things like outcome measures and look at things like objective examination. So getting patients to give an indication of the types of issues they're having as part of that wider MSK problem. What we do with this information then is effectively we stratify the data that comes in against local frameworks. So we're able to customize to effectively take the data that we're collecting up. We use accepted criteria for local pathways, and we effectively then pathway people into those various care services. And ultimately patients will get an immediate outcome that will give them the indication or the information they need in order to access whatever that onward pathway potentially is, which could be face-to-face booking or potential external references, a whole number of different things that we can ultimately direct them into. One of which, oh sorry, I've jumped ahead, but that where we are with this system is today we've done 50,000 assessments. A recent study that we did, which was an observational study, had 100% safety in terms of the outcomes of that system, and 99.9% clinical agreement. So this is where the pathway was adequate or appropriate in terms of sending that patient into the right pathway, but importantly 100% safe, which is obviously the big one that we obviously need to maintain and make sure that we adhere to. But so far a good amount of patients coming through, some very interesting use cases. Oldest user is 94, average user is actually in the 50s. People accessing it throughout the day, but 30% of the time, interestingly, doing it in the middle of the night or over the weekend. Theo Engage is our supported self-management system. This is designed to augment pathways for patients that present potentially through our access system. The idea being that if you present with, say, an arthritic knee, or you have low-grade low back pain, you can be provided with a program that is deployed through our smartphone application that can ultimately manage your pathway through to a successful outcome. It's a very interactive system, so it requires patients to interact with it at a number of key moments, particularly when they're onboarding. We like to get functional goals of patients so that we can use things that relate to their condition, and we can use that as a measure of recovery going forward. The primary purpose of this system obviously is to deploy content that's appropriate to the stage of recovery that they're at, and that's done through this simple interface that people can see in this example, the type of exercises they need to do.
Lie on your back with your knees bent and feet on the floor. Roll your knees while rotating your neck. As you roll your legs.
So the exercises come up in this sort of in this way where we show a video, we do some audio description. Importantly, part of this process and one of the features that is built in at a number of points, but being showcased here, is this idea of shared decision making. So we're really keen to get feedback from patients. How are you getting on? Which bits are you liking? Which bits are you struggling with? Which bits are you finding easy? The idea being that a patient then can actually, within reason, take some control over the pathway themselves. In this example, being able to select potentially easier exercises if things are a bit difficult, or select harder exercises if they want to be pushed a little bit more. So again, throwing a lot of that functionality back to the patient to keep them engaged, but importantly also reduce the amount of over medication that often takes place in these self-management pathways. All information is relayed. Sorry.
Excuse me, Pete. May I just mention there's just 1 minute left for the session? Thank you.
I'll rattle through, no problem. All information is relayed to a back-end clinical portal where clinicians can ultimately take action if they need to, but importantly only when they need to. We collect a lot of information, obviously with triage and the treatment modules, and that enables us to build bespoke pathways, but it also allows us to report back to our customers about the types of users, the types of outcomes that their patients are having, and to enable better care through empowered information effectively. Results for this platform have been pretty impressive to date. 98% of patients choosing to go through the purely digital journey, less than 5% being referred into other services. A high degree of engagement, average engagement, 50 independent accessing points for each pathway. So far results have been pretty positive, and that concludes the presentation. So yeah, really happy to take further questions outside of this. If anyone wants to speak to us, we're keen to talk to. We're engaging with trust right up to ICS level at the moment for end-to-end packaged care. So we'd be keen to work with anyone or speak to people that feel like there could be an opportunity.
Thank you. That's really good and really helpful, really interesting. You've obviously got your contact details there for all to see. If there's any supplementary questions, please do pop them in the chat, or you can come back to one of us at the AHSN, myself or Peter or another colleague, and we can link you up with the innovators afterwards as well. Unfortunately, we haven't got enough time to go into detailed questions with everybody presenting today, but if you have a question or you'd like to link up, we can make sure that that happens quickly afterwards. So thank you. That's brilliant. Now, in the patient education and self-care sort of theme, we've got My Pathway, so welcome.
Thank you. I'll just share my screen. Can everyone see the PowerPoint?
Yes, we can.
Yeah, okay, great. Thanks very much, Pete. That was really interesting. So my name is Judith Clarkson. I'm a commercial director at ADI Health, and our product that we're showcasing today is My Pathway. Just to give you an idea of what we cover, My Pathway is service agnostic, so it covers MSK, but also all of the other services that are out there. But MSK is the one that we are most advanced in terms of the actual delivery, but we can cover each of those 4 areas shown on the themes. I'm going to start with a really short video, so hopefully can you hear it?
My Pathway is our secure digital clinical management platform connecting patients to clinicians, empowering and engaging patients in their own healthcare journey. By creating digital pathways for essential health and care services, My Pathway is a platform for NHS organisations to redefine their patient engagement approach, improve the patient experience and deliver better clinical outcomes.
So My Pathway is a very easily accessible online tool, and it's accessible both for patients and for clinicians. From a patient's perspective, they can upload their own information, and we're interested in measuring our service by patient-reported experience measures, so PREMs and PROMs, their outcome measures. And we need a really robust platform to do that. And if you have a platform that enables you to ask them to upload that over time, then you've got a record from the patient that you can look at together to help plan care. We can look at it also from a system view. I can look at a particular patient's trajectory through their measured PREMs and PROMs, or I can look at a group of patients from a system perspective and understand whether, when we've got very scarce resources, particular interventions or clinics or ways of working are the right thing to make patients feel better.
My Pathway MSK can support clinical management of all MSK services, including rheumatology, orthopaedics and physiotherapy. My Pathway enables patients to have easy access to resources, improves patient self-efficacy, adherence and outcomes. Early intervention for MSK patients is key, and My Pathway supports patients and helps improve rehabilitation as patients feel empowered and in control of their health. Working in collaboration with our customers, we utilise technology to deliver better health, better care and better outcomes.
Okay, so in terms of what the offer is, My Pathway is a digital clinical management platform. So it supports delivery of the clinical service to the patient. We're not a medical device and we're not a clinical service in our own right. We support you to deliver your service digitally where it's appropriate. The whole essence of My Pathway is putting the patient at the heart of it. It's their pathway and it's supporting them through their pathway. In MSK alone, we work with a range of different organisations. Each of these deployments is different because every deployment matches your particular service. So you're not fixed with a certain pathway. There are a lot of similarities in how people deliver services, but there are also quite a lot of differences, and we map the My Pathway delivery according to your particular pathway. We cover orthopaedics, we've got self-referral of antenatal into MSK, whole range of physio, we're supporting rheumatology, other long-term conditions, self-management of patients, so digital triage of patients with simple lower back pain, and then self-management programs for chronic pain, and we're also covering first contact physio. We get really positive feedback from our patient group and from our clinical group. I think the most useful thing, people like to have everything in one place. So because they're accessing everything through My Pathway, they don't feel that they're moving from IT system to IT system or service to service, because everything is in one place. Similarly, for the clinicians, they can look at the individual patient that they're dealing with, or they can look at their own cohort, or the information can be reported at a population health level for CCGs. Key features of the offer, so you should be able to see the screenshot on the right. This is the timeline, and it's the timeline that the patient sees. It's a web app and a mobile phone app as well. Can be used on tablet, laptop, any type of digital phone. And the timeline is the most common thing that is used, so it displays all of the information that the patient requires, including information about their appointments. We can support face-to-face appointments, video appointments, telephone appointments, and we collect PROMs and PREMs and other types of questionnaire responses. We push self-management resources and other relevant resources to the patients according to the requirements of the clinical service. We're also supporting PIFU and partial booking, and telemonitoring and remote monitoring. With telemonitoring, with remote monitoring, the patient is putting in their own readings, and with telemonitoring, they're responding to specific questions from the clinician. Okay, I've just given two really quick examples because time is very, very short. So two MSK examples. In the case of orthopedic surgery, when a patient is being considered for surgery and considering surgery, they are pushed several resources. For example, a link to the joint decision aid, which allows them to input their information, and it tells them how likely the operation is to succeed. They get information about their surgery and also the opportunity to speak to other people who've had the same surgery. Post-orthopedic surgery, for example, the 1-year follow-up, the patient is requested via My Pathway to get an X-ray. They fill in a PROM that is remotely assessed by the clinician, and the clinician only then brings back the patients that they really need to see. The administrative side of that, it's basically administrative free. It works on a clinic code, so there's no extra work for the service to do that. And we've got numerous examples of supporting waiting list management. Physio is just one of the examples, but we can contact the patients to see if they still need their appointment. We can ask them questions to see who needs to be seen most rapidly. They can also at different points respond or permanently respond. So they might be okay at the moment and say they can wait, and then their condition might worsen. They may need to be assessed for walking aid or something like that, and they can do that through My Pathway as well. And while they're waiting, they're provided with useful resources and information on how to improve their condition in terms of reduce drinking, give up smoking, that type of thing. So the outcomes achieved are very much depend on the particular service that we're supporting. But for example, in virtual clinics, we can where services have been bringing back 100% of patients, they can get up to 90% of patients who can be discharged remotely. And virtual clinics obviously show a cost reduction as an additional cost of the consultant doing the remote assessment, but then they don't need to see the people face to face. We've seen various reductions in waiting list management. Obviously, physio waiting list management, we can see a bigger reduction, for example, in hand surgery, because patients don't tend to have got better while they're waiting for hand surgery. And other service outcomes, there's administrative cost reductions and reduction in face-to-face follow-ups. We were asked to explain what our main challenge was, and I feel our main challenge so far has been the best kept secret. So for the last 4 years, we have been really focused on delivering for our existing customers, and therefore our contacts with new organisations have been almost 100% through recommendation from NHS professional to NHS professional. As we're growing, we're now focusing more on our marketing and sales side of the business, so we're reaching out to people proactively, and that's why we're part of today's event. So we're really grateful for everybody's time and attention. For further information, contact us at any time. We're also running a waiting list management webinar, which is, I think, the 5th of October. So please feel free to join us for that as well. Thank you.
Thank you, that's brilliant, and really good presentation there, and really good to see that patient experience and experiential measures are right at the heart of that innovation. So that's fantastic. Thank you very much. So next on the list, just conscious we're running over by a couple of minutes, so if we need to finish at sort of 50 or 53 or thereabouts to give everybody a fair chance. So I'm just keeping an eye on the time. Next up, I'm pleased to welcome Euphonia.
Hi, yeah.
Hi.
Nick de Pennington here. Can I just check whether the slides are coming through?
Yeah, great, Nick.
Brilliant, lovely, thanks. So, hi everyone, I'm Nick, I'm the CEO, I'm the founder of Euphonia. My background is as a neurosurgeon, and it really informs what we do at Euphonia, because a significant amount of what I did day in, day out was highly routine, stereotyped activity that didn't really make best use of my time, and that's something that all clinical colleagues were facing. And so at Euphonia, what we're trying to do is to remove those low value, highly stereotyped activities from clinicians' days. And the way that we do that is we built a technology platform that uses a combination of artificial intelligence technologies to deliver a like-for-like experience for patients from a telephone call from a clinician, doctor, nurse, physiotherapist, allied health professional. And so our system can call up patients, it can have a conversation with them to ask them questions or to answer their questions, and typically both of those things, and then collect and summarize that data to share back to clinical teams and integrate into electronic record systems. And how it works is really super simple. So we essentially have a list of patients, just as you create a clinic list. That then generates calls out to patients done by our automated system rather than a human sitting in a clinic. Those calls take place. A significant proportion of them in the kind of pathways that we're looking at, and I think around MSK, are then successful, and people don't then need to come and see or be spoken to by members of the clinical team, and that information all comes back into the record, so everyone can see that going forwards. What I'm going to do is try and share a very short demo of the system working. The work that we've done predominantly to date has been around ophthalmology, so one of the high volume, low complexity care pathways, but we're just starting to have conversations about MSK, and obviously Pete and colleagues have been facilitating some of that. But what I'm going to show you is a demo of the system working in cataract surgery. So you'll get an idea of the interaction that people have. I'm going to skip through some bits of it because it's a little bit longer than the time we have. And the view that you've got here is just a view for us to sort of monitor calls that are happening, but the system's working independently, and patients just get a call on any phone that they have.
Good afternoon. I'm calling from Stoke Mandeville Hospital to follow up after your cataract surgery. Is this Mrs. Monique Halloran speaking?
Yes, it is indeed.
Okay, great. I'm Dora, an automated assistant, calling to follow up after your cataract surgery. But first, I just need to confirm I'm speaking to the right person. So, my records say your birthday is the 4th of February. If that's right, could you please tell me your birth year?
1954.
Thanks, Mrs. Halloran. That matches. This call will be recorded as part of your medical record.
So I'm going to skip forward and just go to a bit
Someone else on the team will
asking the patient about some clinical questions.
Got a few simple questions about your eye. First up, is your eye red?
Yes, it is a bit red.
Okay, is it just red in the corner by the nose, or is it red all over?
Just in the corner.
And is the rest of the eye completely white?
Yes, it is.
It's normal for your eye to be a bit red after cataract surgery and should get less red with time. Is your eye painful?
And again, let me just skip forward towards the end of the conversation.
Haven't had an increase in floaters, and you don't have any new flashing lights. Does that sound right?
Yes, it does.
Okay, I'll be sure to add this to your records. Before we finish, do you have any questions?
Yes, when can I start driving again?
You can drive again when you can read a car number plate from 20 meters, with or without your glasses or contact lenses. Is there anything else I can help with?
So hopefully that gives a pretty good feel of how the system's working. If I just skip forward. Fundamentally, we're providing benefit to all stakeholders involved. For the patients, we provide something that's highly accessible. So as I mentioned, people don't need any kind of technology to use this. All of the technology complexity is on the back end for us. It means that the system's super reliable. So typically everyone experiences the fact that clinical appointments never happen on time. This always happens on time. For clinicians, we allow them to work at the top of their license. We remove the activities that they shouldn't really be spending their time on. And by doing that, we hope we can reduce burnout as we move forwards. And then for hospital managers and providers, clearly we're able to increase capacity because we remove the need for clinical staff to do these activities. They can be freed up to deliver care elsewhere in the care pathway. And because this is automated, it's highly flexible, so it can flex up and down to meet demand, regardless of what that is. We're working with a number of clinical partners at the moment. So cataract surgery work is happening at Buckinghamshire Healthcare Trust, St Manuel Hospital, in Oxford and Imperial. We're doing some work in ENT in St George's, and as I mentioned, we're starting to have conversations about other high volume pathways elsewhere in the country. A lot of our work's been supported by grants, so we're funded by Innovate UK and National Institute for Health Research, and also SBRI. And because of that, we're very focused on delivering clinical evidence around what we do. We've got the first registered trial in the world of an automated clinical agent, and the interim results of that, and so that's still recruiting and still going on, are really very positive. High levels of call completion and accuracy, and all of our calls include a net promoter score to assess people's experience, and we're rating really highly at the moment. And most importantly is what people say. And so these are quotes. We always ask all the patients in an automated fashion what they think about the system, and so you can read a few of the quotes there. But the fundamental thing is patients, just like us in the kind of administrative and clinical side of the NHS, recognise that a number of their care pathways are simple and routine and should be simple and routine for them, and so that's the thing that they appreciate from our system. And just to conclude, in MSK, there are clearly a number of places where we believe we could automate a conversation with patients all the way along the pathway, from triage, some element of sharing information around shared decision making, preoperative assessment, data capture, potentially a simple check after day case surgery to just make sure that the patient got home and they know what to do over the coming days. Post-op follow-up is where a lot of our activity is focused, and an automated prom collection is work that we're doing in conjunction with Oxford University Innovations clinical outcomes team. So hopefully that gives you a bit of a feel for what we're doing. We're really excited and interested to speak to anyone who's interested in working with us around the MSK pathway, and really happy to try and build out conversations that will support your patients and clinicians. Thanks.
Thanks, Nick. That's brilliant. Some really impressive data coming out of that trial there. So as Nick said, if anyone's got a potential MSK use case or would like to explore further, please do get in touch. That would be fantastic. That's great. Okay, so next up we have Dr. Doctor. Welcome.
Thank you very much. Fascinating talk. Thank you very much for that. I am just looking to load up. Bear with me a second. Apologies, just a bit of a lag here.
No worries.
What's going on? Apologies for this. It doesn't seem to be loading my files. Typical. What I will do then is I'll just share my screen.
Okay.
Okay, can we see my screen okay here?
Yes, we can.
Okay, I'll load it into presentation mode. Okay, is that okay? Fantastic. So Ramsey Ross here, Strategy and Innovation Lead for Dr. Doctor. We are primarily focused around patients' digital transformation. We are, clinical specific pathway agnostic as well, and I'm looking forward to sharing some of our experiences and insights across the UK, but hopefully also share some insights on how this could apply to the specific field of MSK. Fundamentally, we're focused around patient engagement that drives efficiency, helps improve patient experiences, as well as contribute to the bottom line of helping patients improve health outcomes. Fundamentally, we're passionate about the NHS. That has been our sole focus since our founding, and fundamentally, we're here to help the NHS make it work better. Our mission, fundamentally, we are consultancy entity in nature, and we like looking for problems within healthcare, and we fundamentally believe that healthcare needs a reset, particularly in the context of the patient care demand and supply imbalance. And added to that, the situation of having disparate systems within healthcare infrastructure often hinders care delivery as opposed to supporting it. I think the pandemic has obviously exacerbated that even further and exposed the vulnerabilities even further in our existing systems. And our vision fundamentally is a remote-first healthcare system where we can help meet demand without sacrificing care quality. We're not going digital for the sake of going digital. It has to obviously add value and enable interactions between patients and doctors, such as activating self-booking, monitoring, enabling the data acquisition for better, more informed decision making, as well as enabling interactions that can be done remotely by default. This is our footprint across the UK. We're in 35 trusts and health boards at the moment, and we have processed over 55 million outpatient appointments through our systems to date. I think I put this slide in because I think it's particularly important to emphasize kind of a zoomed out view on where we sit. And fundamentally, we believe that there is a third key layer that any digital infrastructure within a healthcare organization should have. EPRs, PaaS systems, we're fully aware of those. However, we're suggesting that there's this patient layer, an outward-facing layer that focuses on communications, automations of various aspects, and I'll share more information shortly, as well as data-related insights. And integrating with EPR PaaS systems is a key aspect of what we do as well. Solution categories, to summarize it, these all fit into 4 key categories: patient communications, appointment management, demand management, and risk mitigation. And across all this, we fundamentally believe in interoperability. And with that, I mean that we believe in building and supporting effective ecosystems that provide best service delivery standards. So, for example, if there's an educational platform within MSK that have video content or so on, like some of our colleagues on the call have presented today, we're all for looking at interoperability and integration, again, to ensure that the patient gets the best possible service delivery, but also in a consistent fashion, in a consolidated, streamlined way in terms of a single engagement point. And the various solutions that we have span across 3 key tiers here. And as you go from bottom up, essentially, level 1 is essentially a foundational stage. It's that first step, engagement step, and we have a range of foundational tools, if you like, that doesn't necessarily add value, but what at this initial stage, but what it does do is help reduce costs, helps reduce improved efficiencies, and so on. Now, as we move north, we start to apply a bit more, let's say, smart intelligence, if you like. We may be looking at how we can automate certain processes. And level 3 is really where we start to once we've overcome operational efficiencies and so on, we start to really add value in terms of, for example, maybe smart analytics, the adoption of AI for looking at, for example, predicting a patient's profile, for predicting an appointment non-attendance. We recently secured a fair bit of funding from NHS England to develop an algorithm against that, to develop that, and so on. Now, we obviously got to talk in the context of responding to current challenges, and we are continually refining our model as the situation evolves and as technology enhancements are made. And fundamentally, we're advocates of a message that, to enable healthcare providers to react to the current challenges that they're facing, but then also to simply improve on existing functionalities to ensure that they don't only address current challenges, but they also are future-proof, and providing that flexibility is something that we pride ourselves on, to ensure that we are completely, always adaptable and can enable our partners to respond to the ever-changing environments ahead of us. And so these are the kind of, let's say, descriptions within these categories. So, looking at wait lists, looking at how we can validate, looking at how we can stratify patients, how we can manage demand more appropriately, more effectively, and how we can improve a patient engagement from a scheduling point of view, from a remote monitoring point of view. And as part of the patient experience piece is how can we educate remotely as well alongside their journey. And just some snapshots here. This is not exhaustive by any means, and please feel free to obviously read through some of these points, and these slides will be available at a later stage after this talk for a closer look. But as an example, if we look at how we can validate an initial step of an engagement, which is popular right now, given backlogs as a first step. A quick question tool can help essentially reduce wait lists from anything from 6 to 16%, 16%, sorry, in less than 7 days of applying the tool. Quick rollouts. And so on. And again, in the context of MSK, wait lists and so on, that's a potential opportunity to get patients seen sooner, effectively. And in the speech bubbles there, you'll see that I've just put in some, let's say, data around how effective we've been. And one of the successful aspects of Dr. Doctor and why we've been so successful is the engagement piece. You can have the best technology in the world, but if you can't get people to use it and continue to use it, then questions are raised as to the effectiveness of that solution. I think the engagement side of things is something that we've done very successfully, in particular removing barriers to access in terms of from an engagement point of view. From stratifying and managing demand point of view, a key message here is stratifying patients based on digital assessment returns. And in order to help triage and so on, optimize the triage process and so on, but then better inform how they're then managed moving forward. I mean, various mechanisms to enable that, patient-initiated mechanisms to service-initiated mechanisms. And an example there, Anna and Bevan in Wales use a various combination of our tools to do this. And to date, they're over 700 forms sent this year, and our completion rates are about 60%. And moving on to another key point around scheduling is scheduling patients based on need as opposed to a time point. As we all know, patients' conditions can change, particularly also within MSK, certain MSK conditions. So it's ensuring that if a patient's being asked to come in or a patient's being asked to engage with a clinician, whether it's through video or otherwise, it's a valued engagement in a sense that it's a needed engagement. So again, you can imagine the efficiencies that we can bring there. And again, you can see the types of benefits that we brought to Nottingham University Hospital at the bottom there. Scheduling point of view, again, I touched upon service-initiated appointments, patient-initiated appointments. And again, I'm happy to share further information on this. I'm just conscious of time, and I'm keen to show you a quick demonstration of how the tool works, or if you like, from a patient's point of view, in terms of what their experiences are. Now, we do end-to-end patient journey solutions, if you like. In this example here, I'm going to focus on one aspect, which is the patient-initiated follow-up with a digital assessment form attached onto that. So you can have a view on what it looks like, and I'll talk as this happens. So I just want to clarify, can everyone see this on the right-hand side of the screen?
Yeah.
Yeah, yes. Fantastic. So in this case, a patient has now received a message. They've been told that they have been onboarded onto a patient-initiated follow-up model. One key thing, everything that we do is highly customizable. So white labeled, of course, to represent the NHS Trust specifically, but of course, in terms of how the texts read and so on, that's very customizable. Obviously, we've got Doctor here, but this could read as you'd like. In this case, we're taking an example of a physiotherapy appointment request where a patient has seen their consultant, but the condition has deteriorated, and they want to see a patient because they have a problem. They have a symptom that needs addressing. Now, with two-step verification, so it's very secure: surname, date of birth, postcode. We cross-check a second step in terms of a security check around against their registered phone number, which then gets sent a security code. And again, this is an example of an SMS interaction. Giving patients choice is a big aspect of what we do as well. So trying to ensure that we give the opportunities to patients to explain their situation, but also particularly around scheduling, to give them the ability to make specific requests on how they want to be seen or where they want to be seen, obviously where appropriate. And you can see, for example, a patient here now just responding to that request or for an appointment. And again, in this case, one of the big things that we provide added benefits is around pediatrics in particular, where parents, kids, things can change in terms of time very, very quickly. So we appreciate that. We want to provide flexibility to parents in particular in that context. Now, in this case, the clinician has decided that thank you for he's thanked the patient for their appointment request. Now, the patient wants to understand the current patient's condition in a bit more detail. Now the patient has asked the clinician has asked the patient to fill in a pre-validated form. These could be ad hoc forms or pre-validated forms as the user or as the healthcare provider chooses. This is just an example of a vigorous physical activity related form. And again, very intuitive, very simple, clickable buttons and type boxes, and the patient can simply provide those further details, which would then be provided to the patient, to the clinician or the administration team that's handling this, to then make better, more informed a decision around how that patient should be managed, whether it's then a video appointment or whether it's an in-clinic appointment, or whether it's just carry on, obviously depending on what the patient has written in the request in the first place. So it provides better quality of information to ensure that, one, the patient isn't going into a clinic unnecessarily, but two, if they do have to go in, the clinician has that information in advance to ensure that they get most out of the session that they're having with the patient at that time. So again, this is just a small snapshot of one type of interaction. There's many combination of interactions. And
excuse me, Ramsey, can I just interrupt? We are out of time. If you can just
problem.
Are we getting to the end? Thank you, Ramsey.
No problem. We always get questions around digital technology and the adoption rates between different age groups and digital literacy and so on. We have extensive data. I mean, we have over 55 million data points across multiple specialties, and we find, I wanted to share some information based on some publicly available data around Deloitte that's published around digital technology against age and in the context of DNA rates that we put together here, and the types of impacts that we have had in on site. This is an example at Guy's and St. Thomas's, where we rolled out patient-led booking, and you can see the types of, it's not just about, obviously patients are the key endpoint here, but it's also about improving impacts on staff. You can see reductions in call volumes and so on that are significant in terms of alleviating burdens on how staff are operating. And we know off the pandemic, morale right now is quite challenged. So how can we help staff? Because they are also key in ensuring that a patient journey is as positive as possible. So thank you very much for that. My details are here. I'd be delighted to talk with potential partners, other providers of solutions, and share further insights.
Thank you, Randy. That's great, and I think that innovation speaks to many of the system challenges and pressures that were discussed at the opening of the session. So that's great. Thank you. We're going to have to move on quickly because we are running over a little bit, so apologies for that. So Open Medical is next.
Hi, yes.
Hi.
Hello, everyone. Let me just set up my screen share. Great. Good afternoon, everyone. So my name is Piyush. I'm Director of Innovation at Open Medical. I'm also a practicing orthopedic surgeon, and I'm going to be presenting Pathpoint, which is the market-leading clinical workflow solution for the NHS. At Open Medical, we're very much a clinician-led organisation, and our aim is to really target those clinical workflows and try and improve the information that is available to the front line at the point of care. So our Pathpoint solution, it's very much a dynamic platform. You can use it for multiple pathways. It is specialty agnostic, as many other solutions are that you've heard about today. And we do cover a range of activities, including triage, synchronization, and because it's a universal, integrated, interoperable cloud platform, it can span traditional organizational boundaries and really help connect systems to deliver data-driven care models and help with future service planning. So as I mentioned, it really does cover the full end-to-end pathway from digital triage, including things like ERS integration, through to real-time dashboards, patient communication technology, and remote monitoring tools, including PROMS and PREMS capture. We're one of the NHS Digital nationally accredited providers, and we're also moving into AI and automation, and we've won a couple of awards with both the SPRI program and NHSX to look at building in AI solutions into live clinical pathways. So what makes Pathpoint so unique? Well, we do use a a variety of clever technologies, and we really amalgamate them to create a unified user experience. So we use natural language processing, including robotic automation and predictive analytics. It's a modular system designed to integrate and fit in around existing systems that are in place and really harmonize with the ecosystem of the technology of the provider we're working with. And as I mentioned, it's a kind of universal cloud solution requiring no on-premise deployment or even resource for management. So it really does provide a plug and play option. This is an example of some of the digital pathways that Pathpoint can power. Now, I appreciate this is very complex, but really it's to highlight the complexity in the feature set that we have. It can traverse directly from referral, so again with the ERS integration or integration with local systems, through to discharge, and have those real-time dashboards with clinical decision support and referencing into MSK liaison services, and as well as reporting to various national reporting structures. And as I mentioned, our final kind of component, which is Pathpoint Predict, is really to build in risk prediction models and length of stay prediction into the clinical workflow. So it's really right at the point of care where it's most important. I think interoperability is key, as been mentioned a number of times. We've integrated with pretty much every EPR system going, and a number of national systems, as I mentioned, including ERS and the National Spine. And we're currently active in over 75 NHS sites. That number is probably close to 1 million patient pathways processed now. And across Yorkshire and Humber, we're about to go live at a site as well. So we've got a very well validated NHS footprint. It's been iterated through a number of units and pathways to really try and achieve that fit for the NHS. So what benefits have we actually delivered? So these are from a number of different organisations. We've managed to save some £500,000 in staffing costs, up to 5 million in efficiency savings. We've nearly a 50% reduction in referral to treatment times. We've helped create some fully virtual pathways, with some pathways resulting in almost 70% of patients not requiring hospital attendance. And overall, that's saved some units 3,000 bed days in a single year. So you can see there's real benefits from deploying digital pathways. And again, this is another example of a simplified version of an MSK pathway involving digital triage, use of protocols which can be triggered with specific diagnoses or specific inputs, both from either user or referrer, having bi-directional communication mechanisms, and then downstream referral pathways to help the patient manage that whole end-to-end journey. So it's been nationally recognised, an evidence-based solution. We've had a number of publications, including an Injury and BMJ Open, sort of extolling the virtues of our system and the benefits that capturing real-time structured data can bring. Most recently, we've been nominated for the HSJ Awards, again with sort of full digitalisation of an orthopaedic department at one of our partner sites. So we're very much sort of looking forward to having conversations with organisations who are looking to kind of implement clinical workflow management solutions, and particularly at ICS level, where interoperable cloud solutions that can traverse those organisational boundaries would be really pertinent and helpful. So thank you very much.
Thank you, and there's some hugely impressive outcomes and impact data there, so please do get in touch if you'd like to learn more and have a conversation pertaining to your patch. That's great, thank you. Okay, so next up we have MSK Accelerator. Hi.
Good afternoon, everyone. Let me just quickly share my screen. Can you see my screen okay?
Yes.
Yeah, perfect. Great. So hi everyone, my name's Tremaine and I'm the Head of Emerging Technology at Northampton General Hospital, and I'm here to tell you about a programme that we are running funded by NHSX called the Automation Accelerator. So a bit about us really. So at the moment we support over 28 trusts across the country with robotic process automation, so effectively a tool that can help automate, highly repetitive, mundane tasks that help streamline pathways, connect different systems together, and much more. And a lot of our, the bulk of our services are free to access. We're supporting trusts at all different stages of their journey. So from never having heard of the words RPA through to they've got lots of automations up and running. I'm going to try and cover these slides fairly quickly so that you have a chance to maybe ask one or two questions. And I'm aware there's been quite a lot of presentations, so I'll keep it short. So in terms of just a bit of context into what RPA is and why it's powerful. So effectively, it combines computer vision, so the ability to interpret information on a screen, with being able to use a keyboard and mouse, logic and back-end integration. And the real key part here is that it effectively, through that, it can mimic a human. So systems that currently don't talk to each other, well, that's fine because it can take information from the screen and type it in like a human. So it's often referred to as a digital workforce. And I think we can all say that there are lots of areas where we could benefit from extra support from an admin perspective. So it's a pretty powerful tool, and it's being used, widely across the NHS. So there are key players you've probably heard of called, Blue Prism, UiPath and Automation Anywhere, and we're vendor agnostic, so work across all of those, and used in almost every area in the NHS. So wherever there is a process, there is often a use case for RPA. So in terms of some of the benefits that we've seen, so one of them is removing human error. So there are handling things like referrals, processing those, putting them into the systems, updating, some of it's in, for example, HR, updating staff records. There's a lot of human error that's removed from implementing this. Increased efficiency is also there because robots don't need to sleep, and scalability. So we found, as demand increases, we have effectively a resilient system that can cope. So I won't talk too much about the technologies underpinning automation because I can share this after, but to just give you a flavour of some of the things that we're working on and have automated at the moment. So one of them, as an example, is in pathology, there is often a load of exceptions that come through for patient records that need merging. At the moment in our trust, there's about a few hundred a day, and there's someone sitting just merging. Where now we have an automation that goes, checks the record, references another system, and effectively merges that record. So that's effectively repurposed a whole person's time who can now focus on other areas. There's also things like effect in the IT side, so creating new mail accounts, Active Directory setup. There's lots of sort of national return type things. So whether it be reporting or take information from a system, there's lots of that there too. And I can go on the stuff in clinical coding and much more. So in terms of just touching briefly on the support that's on offer before sort of giving you a chance to ask any questions. So what our team do is first starting with the sort of strategic workshops, so going sort of right to left here. So we go into trusts and go into all clinical specialties, any area, any front office, back office, and talk through what are the benefits of automation, help identify some key use cases, and then take those through to the next stage, working with the trust to shape a business case, look at what the benefits here, share what other trusts have done, and then the third part is the program support. So the whole idea of this is that this avoids trusts having to reinvent the wheel. So we share automations that are built at other trusts to help trusts accelerate their program. we also have a sort of a one-to-one every month or quarterly with the trust that we're working with to ensure they've got the right support to make their programme succeed. And then finally, we have a huge piece around education. So we've got a whole community hub launching that has information on all of the different use cases that you can look at, and there's going to be some MSK ones on there you can take a look at as well. And everyone from this will get sent out access to that as well. So that's just a brief overview. I didn't want to talk too much, but I wonder if there's any question, if we can take a few questions, if there's time, around automation. Anyone who's heard of it before, has any questions, thoughts, that side of things?
We've just got a couple of minutes, literally. I don't know if there's any, I can't see any hands up or anything in the chat. Does anyone want to jump in? Just a very succinct question or two? If not, we can collate any questions that may come about and share those around later on. Forgive me, I can't see hands up because we've got so many delegates on the line. Do you work with entrepreneurs?
It depends in what the context is, but we can talk to anyone and see if there's any areas we can work together.
Brilliant. Okay, we'll link you after this, so that's great. Thank you. Thanks, Hamish. Okay, so that's great and huge thanks. Really interesting stuff. We're going to have to move on to the last one now, which is Bridget. So I think, have we got Darren?
Yeah, hi everyone.
Hi.
Hopefully everyone's still with us. It's been a long session.
Yeah, we've got about 8 minutes or just over, Darren, before we need to go back to make sure we get into the last session. So is that all right?
Let's do this. Can you guys see my screen?
Yeah.
Yeah.
Yes.
Cool. So yes, I'm Darren. I know quite a few of you guys already. I run a carer support service, so a little bit different maybe to some of the other guys that have gone before us. And what we're all about is empowering family carers and ultimately saving the NHS. That's our ambition. It's quite grand. There's a lot of stuff we need to do to get there, but we're a social enterprise, so we're a business for good. We're a proud winner of a number of AI competitions in terms of what we're doing, and also supported by the NHS through programs like the SBRI. We're a bit stuck right now in the health system. We've got well over 5 million patients to look after that are on waiting lists that we're trying to help to wait well right now. My previous life was a community service director, and I know how hard it is to actually look after the patients and look after the volume of patients that we have today. And on MSK, you know, that's one of our biggest issues for a lot of the people through the pandemic, that they're struggling right now with that condition. What we're looking at is saying, well, actually in the health system, we're stretched. Our clinicians, our doctors, our nurses are stretched already. But we've got an army of people out there, like me and my sister, who are the primary carers for my granddad, Dougie, that spend, for every hour a clinician or a social care worker or a home care worker spends with Dougie, we spend 100 hours as family carers, and there's 6.5 million of us in the UK. So, you know, our call to action is, you know, embrace us, work with us, support us, and we can help the NHS. Hello, dog. I don't know who's barking in the background, but yeah, we can help with the NHS, and that's really where we started. So we started with the premise, if we could empower those 6.5 million people just to make a little bit of difference, just because there's so many of us, we could really change the outcomes in the system, and maybe we can help on that preventative care agenda that unfortunately we don't have capacity right now in the health system to deliver. So we looked at carers, and it's hard to be a carer. You're tired most of the time, you're worrying about your loved one, what's going on when you're not there. You don't get consistent advice from the system. You don't know what's actually out there to help you to look after mum or dad or your brother or your sister. And there's a constant worry that if you get sick, who's going to look after them? So what we've done is built an ecosystem for carers to resolve those challenges. So we've got a system that allows us to provide additional step-down support for people coming out of hospital. So, for example, in this story, Joan's gonna be have a loved one that's leaving hospital. Her dad's leaving hospital this week. She's not too sure how she's going to care for him when he returns home. He receives some remote support. I'll show you some more details of what that looks like in a minute, but he receives our remote support system, which is an accessible, easy to use system that doesn't require any internet setup, but provides all of the data and the insight to inform Joan in the care that she delivers to Grandad. She takes that information, she can view it in the app, make sure that Dad's doing okay, he's up and he's about. She speaks to our care coach teams that we've got, be it our resources or through carer charities, and that's there to really help her on that caring role, to help her deliver that care. And finally, based on the insights that we build from our app and from our store, we basically can then provide tools to support the carer and local services. That approach, we did an initial study with the NHS last year, and through care empowerment, I believe we can save the NHS £14 for every pound we invest in family carers. And yeah, this is the type of stuff we're building out. So we looked initially at the home care space. So how do we provide simple devices? So if you can see my camera, we built a really accessible to use unit for people that don't use mobile phones, mobile apps, so they can effectively engage but also learn from them. So this contains things like air quality sensors, movement sensors, links to SpO2 meters, blood pressure meters. We then integrated with a watch. So this is our watch. It takes heart rate, respiratory rate, movement detection, falls detection, and it's a phone, so it's alerting phone at the same time. And then we integrate with a load of peripherals around the house, so we can make sure that patients are eating, that they're drinking, they're getting the right level of fluid into the bodies, and we do all that from our home care intelligence solution. Again, we build it from an accessible route, knowing that the majority of clients can't use mobile phones when it gets a certain age. And I think it's interesting, the average age for a NEOP is 69, so a lot of people that may be on the MSK pathway wouldn't be able to engage with mobile apps. Our apps themselves are there for the carer as well as for the caring role. So we're looking to support carers with their health, their finances, their personal life, to make sure that, like people like me and my sister, I've got the right frameworks in place on our lives to then provide that care to their loved ones. And our care coach team is there to be booked at any time. So we've got an open appointment system there where you can book in, have a care coach consultation, and get advice based on data and insight on how to provide that care to your loved one. And the last building block in that was the shop. So this is our intelligence shop where we've got 1,500 products now for carers. We can go on and complete a quick and interactive AI-based assessment that's going to figure out what are the products that are going to help you and your dad or your mum or the person that you're caring for. And lastly, just to kind of think a bit about MSK, which is the scope of today. If we think about that pathway, we could provide additional support to carers while they're supporting patients with MSK at discharge, maybe looking at those patients that are currently waiting well. We can integrate to other MSK monitoring solutions, as well as taking the data from the stuff that we've got. So bringing accessibility to maybe all the people that can't use mobile apps with the existing MSK remote monitoring technologies. We can provide techniques to the carers themselves so that they can actually work with their loved ones, help them to rehabilitate and to stay well while they're waiting. We can provide escalations from our care coach team to MSK support and to physios, so that they can actually then speak directly to the patient through our platform. And lastly, we can tailor what we do in the shop around the MSK pathway as well, to make sure that we promote the right products that are going to help people to stay well. So that's probably enough. I think my main ask to everyone is just to remember us as carers that we are the largest workforce that we've got in the UK, providing care day in, day out to patients. And if you care for us, then we'll care for them. And my contact details are at the bottom there. And I guess I'm out of time, so it's darren@bridget.care. And feel free to tap me up on LinkedIn as well. So it's just LinkedIn and Darren Crombie. I'd love to speak to anybody on the call about carers and how you can support carers as well.
Fantastic, thanks Darren, and an interesting, I think, and a very important topic to wrap up on around the importance of carers in